All my life, I had some mouth issues. I didn't start having braces until my 6th grade year. They started realizing like something's up, like my teeth were all over the place.
There were a lot of things that were kind of normal to Kate, but that weren't normal.
I really became aware of her need for it once we knew that the orthodontist had done what he could do. That's when we figured out we need to take the next step.
Out of the 3 that we interviewed, Dr. Nordstrom was by far our top choice to do the surgery. We just really liked his down-to-earth, calm but serious bedside manner. He also, out of the 3, made it the most affordable for us.
He was very good at explaining things. He had a lot of different objects and like a computer in the room to show us exactly what we were getting ourselves into.
Kate came to us with this problem of not being able to chew, with not being able to get her teeth together. The way that we address that initially is we get the patient in and we interview them and we find out what are their problems. What is their chief complaint and can we reasonably address that? Kate's operation that was required was to actually move both jaws. She had a narrow upper jaw that was back and she also had a lower jaw that was back. And so we advanced both of her jaws and we expanded her upper jaw.
When they wheeled her away, I'll never forget that moment because as a parent, you have to have complete trust at that point in the surgeon. The recovery was as difficult as he said it was going to be, and the first 2 weeks were extremely hard.
It goes down a lot, but you look like a chipmunk. Like, you've got pretty big swollen cheeks. So it wasn't like until a month in that you could actually see kind of what the difference was. Looking back on pictures, it's like weird looking back on it because I forget what I used to look like.
It's made a big difference not only in the way that she's able to eat and breathe, but also in appearance. It's just really made a great impact on our lives.
And if you just stay positive through the whole thing, that it's a lot easier. And the results afterwards, you can definitely see them and they're definitely worth it.
I think you see it in Kate, the results of the surgery. I mean, her teeth can come together, she can eat what she would like to eat. She reports that she's sleeping better. In addition to that, you just see it in Kate's face that she's a happy individual, that she's happy to smile and she's confident. So, if you are on the edge about having jaw surgery or thinking that you might need jaw surgery, it's not going to cost you anything but time to come in and chat with us, and there's not going to be anybody here ever that's going to tell you you have to have surgery. Our goal here really is to make a transformation in people's lives.